Labor and birth can seem really complicated, right? How do you get a being that's inside your body, outside of your body? And it can feel really overwhelming to prepare for such a big life event. But today I want to tell you 3 ways that you can prepare really easily in your regular life for your upcoming birth. And honestly, I'm just thrilled that you guys are here, even thinking about preparing for your upcoming birth, because I'm here to tell you that it is going to make a better birth. So I'm glad that you're here joining me, Hillary, the pregnancy nurse. I've been a nurse since 1997. I have 20 years of labor and delivery experience, and these things are going to speak to the things that I've seen at the bedside with all of my thousands of different pregnant patients. Now, the first one is to learn to ask questions. Someday, this baby that's inside of you is going to be 3 or 4 years old, and you are going to find out that their entire life is questions. Why does it do that? What's that look like? Why are you doing that, mommy? And in your mind, you're going to think, I would just love a little peace and quiet. But the reality is you are teaching your child everything about the world. And sometimes, as I've watched kids ask all those questions, why are we not still asking all those different questions? Now, of course, we have Google on our phone, so we get to ask all sorts of different questions like that. But we also spend our entire school career asking questions, and we have teachers who encourage us to ask questions. But when we get out into the real world, it feels like people don't want you to ask questions. Now, I am here to tell you that your labor and delivery nurse absolutely wants you to ask all of the questions that you want. And your provider is also really open to asking questions. I'm just here to tell you that sometimes it takes a little bit of practice to learn asking questions as an adult. There are going to be times in the doctor's office where they say something and we may literally have no idea what they're talking about. They may say, I want to put you in for an NST. And you're like, sure. But you don't know what that test is or what it's for, what it's measuring, right? You have no idea what that is. And a lot of patients are going to say, cool, I'll go do an NST, not knowing if it's like even just like a torture device. But the smart ones, if they have no idea what that is, are going to say, hey, what is an NST and why are we ordering it, right? You're going to start asking questions about that. And I'm actually here to tell you that you can start this as early as those first ultrasounds. Your provider is going to say, hey, I'd love to send you in for an early ultrasound. Looks like they can get you in on Thursday. And in your head, you're like, absolutely, I want to see this baby. I want to make sure that everything's going right. But this is your opportunity to start asking questions. Hey, what do we learn at that ultrasound? Do you recommend it for everybody? You can ask all the questions that you want, and you're starting to build that muscle of asking questions. Because I got to tell you, as an adult, we're not great at this, myself included. I had my appendix taken out a couple of years ago, and I immediately reverted back to that state where I wasn't asking questions. So I'm telling you that this is hard for everybody, including even nurses who are hospitalized. I would say that a lot of us just feel like our doctor knows best, and we don't need to ask them questions because it's just going to waste their time. And I'm here to tell you that your doctor doesn't mind answering these small questions that you have. These basic questions, they're gonna have the answers for you, and they probably are really happy that you're even asking, because there's a lot of patients who don't want to know and honestly don't even care. So when they see a patient engaged in their care, it's kind of exciting for all of us. So I don't want you to feel like you're a little kid or you don't know what's going on. None of us are born knowing what an NST is or a BPP or honestly why babies get ultrasounds. So asking those questions is fair and valid. And remember, you are paying that doctor to be the expert in the room to tell us those different things. So don't go home and then use Google to tell you what an NST is, even though that might be what brought you here to this video. Now, there is a lot that you can build that foundation of knowledge to feel a little bit more confident, so you're not asking questions about what even is that test, and we're going to talk about that. That's the third one, so stay tuned for that one. By the way, is there something that your doctor ordered or talked about that you were like, I literally have no idea what he's talking about, and just sort of nodded? Or you asked the question, tell me down in the comments, because sometimes I'm surprised by what people don't know about, because when you're spending all this time, just talking about certain things, sometimes you forget that not everyone knows everything about these different things that we talk about. So tell me down in the comments. The next one is to get on the same page with your partner. And I got to tell you, partners envision birth very differently than you have probably envisioned birth, and probably neither of you are correct, because the media doesn't do any of us favors, men or women, about birth. But you getting on the same page with your partner is really going to put you on the best foot forward moving into parenting together. So who is going to be in the labor room? You might be thinking your mom's going to come, but he's thinking, great, my mom's going to come. And you're thinking, heck no, your mom's not going to come. Or maybe you're thinking, yes, I would love the more the merrier. Or you're thinking, no, my mom is not going to come. I think just getting on the same page about simple things like that really helps you to get on the same page about simple things moving forward. Other things like where the baby is going to sleep or who's going to come help you after you have the baby are really important things to get on the same page about. And it's really easy to bypass a lot of that because you're thinking just about what's going on right now. I think far too often partners are left in the dark because they're probably not watching these YouTube videos and they're probably not following me on social media. And you're doing all those things, so you kind of think they know similar to what you do. Anyway, get prepared together. Which brings us to number 3, which is getting prepared. And again, do it with your partner. Studies have shown that birth classes can decrease C-sections, decrease inductions, decrease interventions like vacuums and forceps, and they increase people's overall birth satisfaction. They're just happier with their birth. Now, it's amazing that just a small class, the class that I recommend, just takes 3 hours, can really make a better birth. And it is easier to do it with your partner. I know you're thinking, Hillary, I'm here on YouTube and I'm preparing for birth that way. But for you, it's really easy to skip something. The thing that you might be skipping is involving your partner in getting prepared for all of this. The online prenatal class for couples helps your partner to know what's happening. It helps you to know what to expect in the hospital so you feel confident. Again, it gives you that baseline of understanding so you bypass a lot of those sillier questions and get to dig in a little bit deeper about how they apply to you. You're going to understand your options. I'm always giving people choices and what else they could pick during their hospital stay. And prepared parents birth better. So I'm going to put the link for that class down below. Sometimes I think people think they need to know about like all the ins and outs about physiology of birth. And I'm here to tell you that you mostly need to know the basics and then how to apply the basics to that situation that you're experiencing during labor. And a good birth class will do just that. But no, you do not need to go to medical school. That's why you're paying for an expert. Thank goodness. Now, we've talked about birth, but sometimes the ugly stepsister of preparation is postpartum. And I think it is so important to prepare postpartum. I have a whole video on preparing for postpartum. I'm going to link it up above and down below. Thanks for joining us here at The Pregnancy Nurse, where we get you prepared, not scared, for your upcoming hospital birth.